about your family history. Is anyone from your family having the same type of disease?
More information, family history.
Your father used to take aspirin, so I believe that he is a heart patient. So that could be okay. Could you please tell me about your personal habits, such as do you smoke or drink or something like that? When you ask, always put a smile on your face because they will feel bad. Okay, that's not. So your smoking could be a reason behind this, but however, we will talk about that later. So here I finish his history taking. My next step is to go to focused assessment. So I would need a stethoscope. Put an adult stethoscope from there. Adult.
هذا حق يعني أنا حق
Get the pediatric one for time being.
وش الحين ما خلص؟ الحين بالستethoscope.
So
what are we going to assess with the stethoscope?
Okay, what I will do now is I will do a focused assessment, focused physical exam.
On the way.
Chest.
On the chest.
On the way.
The hospital is far.
We are already on the way. This all history has been asked on the way. So what I will do is I need to.
If we have time.
Please say for it.
نافع. أكيد نافع أحسن أحسن. أوضح. نافع جوال.
What I'm hearing here, what this location is?
A heart.
Which part of heart?
Right ventricle.
Apex of the heart.
Apex?
So apex of the heart is actually used for the better hearing of the heart sound. S1 and S2 is very clearly audible.
What's the apex?
Apex is like, this is your heart, isn't it?
Yeah.
This is the shape of your heart, and your heart is located like this. So you see a corner there. There is a corner, isn't it?
Yeah.
This corner of the heart that contains actually the left ventricle.
Yeah.
Left ventricle, the biggest chamber of the heart is here. So this apex part is little bit, heart is located in the middle. At the same time, the apex of the heart or the left ventricle part of the heart, apex of the heart is little bit directed to the left side. So that's why when you want to hear the heart sound better, the apex of the heart that is little bit to left at the fifth intercostal space, besides the nipple, besides the sternum, here is the location.
Between the nipple and midline.
Regarding respiration, you assess the 4 points, 1, 2, 3, 4. Also, it's a good practice to assess the back side of the chest. That's again these points. Take your break.
4 points.
So when you examine the chest, examine the front chest as well as
the same locations, the same points.
The posterior chest. This is only a focused assessment of the part which is affected. Now we have one more thing remaining in the primary assessment. What is that? One more thing remaining in the primary assessment.
No.
Transfer decision. We have taken decision after the initial assessment that this patient is a serious one. I will rush him to hospital. We are already in the ambulance. Now 1 point missing in the initial assessment of this patient. Think of vital signs. We did not check his vital sign. We will check his blood pressure, his pulse, his respiration, his pupil and his skin color, temperature, capillary refill, all those details. So after doing this,
after doing the checking the lungs,
yeah. This could be vice versa. It's not very hard and fast rule. If you could check vital signs first, then chest, or you could check chest first, then vital signs. The idea behind doing chest first is, I will tell you psychology behind it. You have an abdominal pain, for example, and a doctor came in, he asked you all the story about the world, all the history. He asked you about your family, he asked you about your personal history, everything. But he did not even touch your abdomen now, and he is going to touch all other vital signs. Would you be happy with that?
No.
What you will expect from the doctor?
Nothing.
He checks your abdomen first. Then he go to the remaining things, isn't it?
Yeah.
So that's a good practice before you go to vital signs and other physical exam. First physical exam should be the system affected. I'm not telling about the part which has pain. The rule says you examine the pain part after you examine the other part. But start with the system which affected. That would make your patients happy because he wanted you to be attentive to his problem. So his problem is chest pain, so you will be happy when I examine your chest, isn't it? Is it right? Then you examine his vital signs. So I finish my primary assessment. What next? Primary assessment. Before I jump into ongoing assessment, I need to do something with this patient. It's a treatment. Treatment part of it. So it's like I'm given oxygen already. Very good. Now I have blood pressure and other details. So I can decide whether I can give nitroglycerin or not. I have allergic history. So I could decide if I can give aspirin or not. Any allergy I asked him, isn't it?
Yeah.
So he's allergic to aspirin or not? Allergy. I'm talking about if patient is allergic to aspirin, you cannot give.
Okay.
If patient has any other problem with aspirin, he cannot give. So we have blood pressure measurement, so we can give nitroglycerin now. We have allergic history, now we can give aspirin now. Then reassurance is continuous process. Position of comfort is a continuous process. Continuous process.
مستمرة.
It's not one time. Reassurance one time خلصنا. It's a continuous process, isn't it? Position of comfort is a continuous process. So this is the basic treatment of a patient with chest pain, and we are on the way to hospital. Now it decides whether to go directly to ongoing or detailed physical exam. What it decides depends upon. So you ask your instructor how long I am from the hospital. So usually tomorrow we will give you a long time. Why? Because we want you to see doing the exam, physical exam. That's why we tell you what?
Take your time.
The transportation time is too long. So now I will go to a detailed physical exam. It's a quick detailed physical exam, not very comprehensive.